Way back in 2021, I made 2 videos talking about things that clients do to annoy veterinarians. The videos are not great, and you are under no obligation to watch them. In the interest of fairness, today we're going to discuss things the other way around, how veterinarians annoy pet owners. Now, all joking aside, I think this is important because earning clients' trust is very important. Without it, they won't listen to you, they won't come in to see you when their pets may need it, and ultimately this impacts the well-being of the animals, which is suboptimal. We're going to talk today in this video about 5 specific items, which I picked because 1, they occur very commonly, and 2, I'm guilty of all of them as well at different points throughout my career. So without further ado, here are 5 things that vets do that annoy pet owners. All right, guys, before I get into that, please, if you don't mind, hit that like and subscribe button. If you liked what you see here, help me grow the channel, help me spread all this information I'm trying to get out to you. Let's get into it. This first one is near and dear to my heart as a neurologist. Neurologic deficits are sometimes very obvious, like paralysis, but many times they're very, very vague, they're episodic, and they don't occur while I'm evaluating the pet, or they're just kind of hard for the pet owner to explain to begin with. At the risk of being an alarmist, let me describe one specific example of this. It's not uncommon for a pet to have a problem in their brain, like, say, a tumor, that creates very little in the way of symptoms. This is because animals don't use a lot of the brain the way people do. Animals don't read, they don't write, they don't drive cars, they don't talk to each other, at least with verbal language. And they don't do a lot of the things that people do. So a lot of their forebrain, that's the front half of their brain, isn't used in any discernible way to us humans. Thus, when those areas don't function normally, we don't notice it a lot of the time because it doesn't create an outward symptom or deficit. Problems like brain tumors can sort of hide out there for a long time before anything obvious occurs, like a seizure, for example. But sometimes really astute pet owners will observe some slight behavior in their pet that's just a little bit different, and sometimes their suspicions are actually correct. And what I've learned not to do is to blow people off and just assume that they're full of it. You'd be surprised how often this happens in vet-client interactions. I'm a very naturally skeptic person, and I had to turn this part of me off early in my career to kind of start understanding this better. It can happen for a lot of reasons, ranging from lack of experience, knowledge base, maybe the vet's in a bad mood or something's going on that is making them not at their sharpest, who knows? I'm guilty of all the above. Look, we're human too, things happen, but anytime a client doesn't feel like they're being heard and they're not believed, that is a recipe for sowing mistrust. And we've all heard stories like, my friend's cousin's dog had diagnosis XYZ and they took the dog to 5 vets and no one believed her, and it turns out the dog had terminal cancer. Are these types of anecdotes completely true all the time? Of course not. Do I think a huge number of vets just blow clients off a lot? No, I don't. But I do think there's perhaps a kernel of truth in there that may come ultimately from a client not being believed here and there. So if you're a pet owner and your dog is doing something weird at home, but it's vague and episodic, I always recommend getting a video of the episodes at home, perhaps in that 15-second to minute range. Have your vet review it in case it's not reproducible in the clinic. And don't be afraid to advocate for your pet. If you feel like something's off, but you're not sure, be that person that kind of speaks up for your pet. Have you ever taken your dog to the vet and come time to pay the bill, lo and behold, you have a lovely surprise in the form of a bill that's hundreds of dollars more than you thought it would be, maybe even thousands more? This happens all the time across vet med, and I'm just as guilty of this as anyone. Now, it's understandably quite annoying, if not devastating, to say the least, when someone tells you something will cost X amount of dollars and it ends up costing X plus 900. Now, I'm not making excuses here, but there's a few reasons why this happens. The first is sometimes an unexpected complication occurs during a procedure. Now, we see this a ton these days with brachycephalic or flat-faced dogs, talking English and French bulldogs and the like. I made a whole video about Frenchies and pugs and all their problems. Go check those out if you haven't. I'll be making more on other breeds, by the way, so stay tuned. These animals will come in for one problem, get so stressed out in the hospital they have what's called an airway crisis, meaning they can't breathe, and suddenly you're dealing with a respiratory emergency in addition to the original problem that they were there for. I can't even tell you how many Frenchies I've seen come in for back pain or paralysis from a herniated disc, and within minutes they're having to have emergency surgery for their airways superimposed onto their original emergency, which is an MRI followed by emergency back surgery. So within the span of about an hour, this will add thousands of dollars to a bill. And stuff like this happens so suddenly that if you don't account for it in a cost estimate, it can be a huge surprise for all parties. The problem is, if you put it in a cost estimate on every brachycephalic dog you see, assuming the worst could happen, then everything you ever do to them costs thousands of dollars more, at least on an estimate. And then suddenly you're the overpriced vet that nobody wants to see. I don't really have a solution to this problem, admittedly. I'm just saying these are the mechanics of this problem. This is what happens behind the scenes. The second reason clients go over estimates a lot of the time just has to do with lapses in communication. This is something that vets could probably do better on, at least as a generality. Sometimes vets do a bad job explaining the costs or the range of costs to owners. Again, this goes back to perhaps experience, or perhaps, sometimes prices are increasing in the hospital and we can't really keep up with that because we spent the last 2 years having a set cost in our minds, and then suddenly the private equity firm raises it. Never mind. We won't get into that now. Sometimes the estimates don't get physically signed by the owner, for instance, due to clerical errors. Or sometimes vet practices are simply so busy that a mild medical complication occurs that's an easy, quick fix, costs a little bit extra, but there simply is not time to call you, the pet owner, with an update right then and there, like, for instance, in the middle of a surgery. An example of this would be during a surgical procedure, a pet's blood pressure or their heart rate drops, and they need extra IV medications or some interventions to get them through that. Then their vital signs normalize and everything's good. Dog recovers fine. Surgery went fine, but it just required a little more than was expected. These are just a couple reasons why invoices go over the cost estimates, but the take-home message here is, it's annoying. It can be really financially stressful on you, the pet owner, and I can understand why somebody would be super pissed about it. However, when you're reviewing a cost estimate for a procedure of some kind, look for ranges in cost on the estimate rather than a fixed number. Every estimate I make has a little bit of padding to account for complications that shouldn't happen, but they do. And just know that at the end of the day, this is the practice of medicine on animals, and there is no way to predict ahead of time with 100% accuracy exactly what an invoice will be once things are said and done. It's called an estimate for a reason. Now, I think about this all the time because it happens with almost every patient I see. I review the history, I go over exam findings, propose a diagnostic and treatment plan, and then I finally, at the end of all that, ask you for money. Now, in human medicine, this is not a thing as far as I know, because you have this other thing called health insurance that you pay hundreds of dollars a month for that subsidizes the cost and removes any sort of doctor-to-patient direct transaction. In theory, at least. I know. But veterinary medicine is different because we don't have insurance embedded into our industry like it is in human medicine. Veterinary medicine is purely out of pocket. It is the practice of medicine as an out-of-pocket expense. And I know there's pet insurance these days, but that's still a very low percentage of pet owners that have that, and the vast majority of companies reimburse you after you pay the vet. So even with pet insurance, it's an out-of-pocket and upfront expense. Because of that model, you have to pay your vet for this animal health care. That's just the way it is. Maybe that changes one day, who knows? But for now, and in all of VetMed's history, it's pretty much been that way. But what this means is that we vets have to ask you for money before we can help your pet and render services. We have to do this because the cost in providing this care is immense. So let me give you an example. Let's say we're doing an MRI on your dog, and an MRI machine, in case you didn't know, costs somewhere around $1.2 to $1.5 million to buy and install into a hospital. It consumes thousands of dollars worth of electricity each month, requires special MRI trained technicians to run and maintain it, and animals need to be under general anesthesia the entire time because, in case you didn't know, no animal is going to stay still for an MRI, those of you who have had MRIs yourself. This is a high-level example, but I want to drive home the point that a vet clinic can't afford to do all of this without having a deposit in place and a person paying their bill. There's just too much cost. Again, this is what practicing medicine as an out-of-pocket expense looks like. It's what human med would probably look like if Medicare and Medicaid wasn't a thing. Now, does this create a conflict of interest? Maybe, but what's the alternative? The human med model? Does that industry really seem that much better? I mean, this guy seems to think so. This is a bit of a tricky one, so let me walk you through an example I see almost every week in clinical practice. Let's say a dog comes to see me because they had an episode of severe pain a week before. They were in the ER for having really bad neck or back pain. They saw their vet. The vet prescribed pain medications. They recommended Fluffy see somebody like me for a neurologic exam and evaluation. I see the dog a week later, and lo and behold, thankfully, Fluffy is normal. No pain on an exam, no functional deficits. Dog's running around, barking like nothing ever happened. The owners say Fluffy has been acting herself the last few days, so what do I do? Now, it should be obvious what I should do. I should clearly refer this pet to an animal chiropractor like this guy, who will do a full Nelson on your dog and cure them. Just kidding. Never do that. The real answer is nothing. Fluffy symptoms have resolved, so there really isn't much else to do at this point other than to maybe finish out the previously prescribed pain medications and monitor for relapse at home. But you'd be surprised how many times I have to talk people out of doing something like an MRI in this situation. The reason being, an MRI very likely won't change the plan because Fluffy's pain and symptoms have already resolved. So if I did an MRI and found, say, a herniated disc, I won't recommend surgery or anything, most likely, because, again, the symptoms have resolved. The last thing I want to do is put Fluffy under anesthesia, spend $3,000 to $4,000 of the client's money, and end up right back where we started, which is continuing to watch for a relapse of symptoms. Now, if Fluffy relapses and has another pain episode in the near future, different story. In general, I try to be very careful, especially these days with the cost of these diagnostic tests, prioritizing their value and making sure the results actually mean something and affect what I do or don't do. You'd be surprised how many vets out there will shotgun blast all sorts of diagnostic tests, sometimes multiple times, with no discernible change in plan. I know that may be a controversial take, but I got to call it the way I see it. Pet owners will pick up on this eventually and understandably be quite annoyed, to say the least. There's so many examples of this in veterinary medicine that honestly, I could make an entire video about it. Some that come to mind would be things like spinal x-rays on paralyzed chondrodystrophic dogs. We're talking about breeds like Dachshunds or Frenchies, where a spinal x-ray has a 99+% chance of adding no value whatsoever to this clinical scenario, but costing $300 to $400. Or perhaps something like a staging abdominal ultrasound on a cat with seizures who has normal blood work. Seizures localized directly to the brain. The problem's there, not in the abdomen. Ultrasounds cost about $400 to $500 plus these days. Why add that cost to the bill if there's a less than 1% chance of adding any helpful direct information to the cat's actual problem, which is a seizure, brain localizing symptom? So my advice to you, the pet owner, if you're unsure as to why your vet is recommending a diagnostic test, just ask for an explanation. Totally fair and justified thing to do. Ask what the actual value and change in plan that this test generates is. If your vet can't justify it with an explanation, factor that into your decision making. Or even worse, if a vet starts to get agitated with you about asking questions, really factor that in. Totally fair to ask questions. Look, pet obesity, as insane as it sounds, is a real thing and a real problem. Dog and cat obesity doesn't quite affect them, as far as I know, the way it does people. They store fat differently than people, and they don't really develop stuff like atherosclerosis or plaques in their arteries that lead to heart attacks and such. A little different physiology going on there. But obesity in pets is still pretty important. If anything, it's just a contributor towards pain and immobility. Imagine being an arthritic dog carrying around 20 extra pounds when your ideal body weight is like 15 pounds, and you kind of get the idea. So it's an important issue, and it needs to be brought up and talked about and managed by your primary vet or a vet nutritionist. By the way, if you're looking for a board-certified vet nutritionist for your pet, you can search for them on this website right here, vetspecialist.com. This website is a branch of the American College of Veterinary Internal Medicine, so you can search for specialists by entering what specialty you're looking for, what type of animal, your location, and voila, you can find specialists near you. Many nutritionists do online consultations as well, so if you oftentimes don't even have to bring your pet into a clinic. They'll just do it over a Zoom call. The problem with pet obesity comes in the fact that sometimes it is communicated in a way that's maybe a little bit suboptimal. For example, here's what I've seen happen. Fluffy comes in for an exam, things looked okay, but the vet says, look, also, Fluffy is obese, so maybe we should consider a reduction of treats, reducing caloric intake, increasing activity going forward to try to help get her to lose some weight. But what the client sometimes hears from that is, your dog is fat, I know you think you're doing well and caring for Fluffy, but Fluffy is morbidly obese, so in fact, you're failing as a pet owner. Do better as a pet owner and a person. Maybe not exactly that, but you get the idea. Now, I don't know how to fix this per se, but I just want you, the pet owner, to be aware of the fact that no one is making fun of your pet. No one is judging you as a caretaker per se. We're just acknowledging the reality of the situation when we assess a pet as being overweight. It's like reporting an abnormal blood work finding. Please, don't take it personally. We're just trying to help, and some of us may be just kind of blunt in how we communicate. Couldn't be me though, right? All right, guys, hope you enjoy this video. Let me know in the comments below if there's something that I missed or that's something that has annoyed you in interacting with your veterinarian. I'm sure there's nothing there, right? And if you don't mind, guys, please hit the like and subscribe button to help grow the channel. I really appreciate you watching this video. I'll see you on the next video. Peace out.